So, Dr. Flynn, in sports, we see it all the time. Athletes jump, land, they roll their ankle, but lateral ankle sprains are so common in the general population. I mean, you could be doing a shimmy after you've eaten a delicious meal, and boom, you've twisted your ankle. Why are ankle sprains so common?
So ankle sprains are so common because when you think about or know about the anatomy of the foot and ankle, the way the foot and ankle functions, it just exposes risk to the lateral structures just to based on the allowable motion on the lateral ankle. And then with patient's mechanism of injury, there's natural instability in the inversion. So when the ankle goes to roll in, when the ankle goes through dorsiflexion, plantar flexion for natural gait, those structures on the outside are exposed to risk naturally. Additionally, like in the American population, as we know, we look at the statistics, okay, the average American now is obese, or they're overweight, they have an increased BMI. Well, that puts extra strain on the tissue. And so when you just think about center of gravity and mass loading, as that mass center of gravity shifts, the ankle is very easily to roll. And so,
Okay.
and then naturally we perform at-risk activities. And so like you hit the nail on the head, sometimes patients will have a structural instability or a functional instability, and then that also plays a role.
So, after a sprain, some may not have the money or the time to see a doctor immediately. How
Mhm.
can one know if the injury requires immediate attention?
The best thing that can guide a patient on whether they urgently need to see somebody is the amount of swelling and bruising. As I tell patients, the reason you have a bruise or what we call ecchymosis is that's tissue tearing. The more bruising, the more ecchymosis, the more swelling, the more pain they have, the more urgent they need to be seeing a foot and ankle specialist or a surgeon for urgent evaluation. You know, if you slip and miss a step, you feel a little twinge, you're like, oh, I think I rolled my ankle, you have a little bit of pain, not significant swelling, not significant bruising, that's the time to implement a simple RICE protocol is what we call it, which is rest, ice, compression, and elevation. That's pretty universal for all soft tissue injuries. If you're not feeling drastically better in the next 2 to 3 weeks, you need to call a specialist.
Now, what if they do have an increased amount of bruising and pain, but they're able to walk on it? Should that still be a sign of concern?
It would be a sign of concern. You know, I meet a lot of patients, especially younger ones, because they're able to tolerate a lot more. Just less than 10 days ago, I fixed an ankle on a 20-year-old kid. He rolled it, landed on a friend playing frisbee, didn't think of anything of it. His mom looked at it, he's like, "Whoa, that's really bruised." 3 of his ligaments were ruptured. He needed to be fixed. He was like, "I can walk with no pain, but if I go to move or do anything, higher yield or turn or struggle with stairs, I have a lot of pain. But just walking, it's pretty lax and pretty straightforward. I don't have an issue." That can be common in patients because it's until you start to strain the tissue that's no longer there, you're going to be fine. The best analogy I use for patients is your ligaments around your ankle, they function as a seatbelt. You can drive your car without a seatbelt and be fine. But when you hit somebody and you don't have your seatbelt on, you're going to have a big issue. And so it's the same thing for the ankle where it's like, you can get around and you can skate by with no ligaments, but you're going to have an issue when there's that, oh darn moment where something bad's going to happen.
There's not much bruising, there's not much swelling. You can walk on the ankle. Does that mean it's something that you can manage at home?
I think it's reasonable at that point. You can try to manage it at home for like the next 10 to 14 days. Ice it. It's best to get a supportive ankle brace on there just to keep everything protected. If you don't have a brace, you can pretty much order one on Amazon and get it to your house pretty quickly. Additionally, a simple ACE wrap just to provide some additional compression and support. If you implement a pretty strict regimen of an anti-inflammatory icing and support, you should see improvement in that ankle in about 10 to 14 days. If you're not seeing that improvement, you might have missed something or you hurt it worse than you thought and needs to be evaluated.
And you mentioned that they can purchase a type of brace at the store. What type would you consider? Should it have support on the sides? What kind of brace is that?
My go-to on Amazon is like what we call a lace-up ASO ankle brace, which is an ankle stabilizing orthosis. The ones that we like are made out of kind of a nylon material. They slip on your foot and your ankle kind of like a sock. They lace up, and then there's Velcro straps that go around to kind of secure and stabilize everything. The best thing that you can do with basically any orthopedic injury is support that extremity as much as you possibly can. The most common mistake patients make is they just buy a simple ankle compression sleeve. Well, that's not a bad thing. You're still decreasing the edema and the swelling, but you're not offering as much support as from a lace up or a strap based ankle brace.
For those with a bad sprain, does it typically require surgery if they get seen immediately by a doctor?
Only in really severe cases. I would say lots of times the standard of care, at least in the United States and in the majority of areas, is that even if you saw a really bad sprain and you see that patient, you're really concerned for a higher level of injury, you would get an MRI. And then once you get the MRI, you're able to assess and see the amount of ligament damage. And depending on the amount of ligaments involved and the amount of instability in the joint would really guide that decision making. I would say probably about 90 to 95% of those cases, you're still going to treat conservatively. And conservatively, you'd immobilize them, proceed them into physical therapy. And so most of the time, we try to get those patients to fail conservative care. Okay, give the ligament an opportunity to heal, keep it supported. And then once we start to rehabilitate that ligament, if it's still not doing the job that it needs to do, then you fix it. Very rare instances, high level injuries, high level of damage at the initial insult, you would fix it acutely.